Dr. Puneet Verma. We have found that it's not only the physical health but even the mental health of patients which have suffered immensely during this time. Our medical treatments on the interventional and surgical front have always been classified into selective or elective and emergency procedures. Now, majority of patients who suffer from cardiovascular diseases rarely would fall into elective surgeries. But having said that, we do understand that there are certain procedures in our science as well where delaying treatments or deferring treatments for a while are not likely to make any major outcomes in patients and are not going to impact outcomes in patients. However, on the surgical side, when you consider about performing emergency surgeries, whether it is in the cath lab or in the operation theatre, we do believe that these procedures cannot be delayed or deferred. There are certain conditions in the heart where we believe that delaying treatments would obviously be very detrimental, and these are conditions where patients are suffering from multi-vessel coronary artery disease, critical diseases which affect the functioning of the valves of the heart. So diseases of the blood vessels of the coronaries in the heart and the valves of the heart are very common. One of the very major silent conditions of the elderly population is an aortic valve disease. Especially when these valves get blocked, the medical condition is called aortic stenosis. The patients commonly come to us with this condition and suffer from symptoms like breathlessness, chest pain, fatigue, and in advanced stages of the disease, they even have symptoms of syncope, which means they actually tend to lose consciousness at certain times in their day-to-day activities. Potentially lethal condition, and if treated in time, this can be potentially life-saving, restores the quality of life in the elderly population, and makes their next 10 to 12 years of living very comfortable. Conventionally, aortic valve disease has been treated by the surgeons in the operation theatre with an open heart surgery, which is called aortic valve replacement or surgical aortic valve replacement, as is called SAVR. Now, SAVR in modern times has been replaced by a procedure called TAVR, which stands for transcatheter aortic valve replacement. This procedure is carried out by us interventional cardiologists in the cath lab. It's a procedure which is commonly done with minimal sedation, needing no general anesthesia, and is commonly done from the artery of the groin. The procedure lasts for about 45 minutes to 1 hour. Stay of the patient in the hospital is very restricted to just about 3 to 5 days. The recovery is fast and patients get on to their routines of life in a very short duration of time. So the other advantage these patients have is once we restore their quality of life, it's also important to understand that TAVR as a procedure has much lower risk of strokes, lower risk of death, and lower risk of permanent pacemaker implantation compared to surgical aortic valve replacement. We always believe that prevention is better than cure, and we also believe that if in doubt of your health, of any symptoms which you think may or may not be correlated or may or may not be related to your heart health, we believe that you must come to the hospital in time and get your treatments and get your checkups done and accordingly follow the advice of your doctors. Thank you.